call the June 9th meeting of our Health Committee to order. And we have very nice communication this morning. I'm going to have you read
I am Shauna Lundy, and I am the Deputy County Clerk, and I'll be the minutes today. And I am Abigail Heineke, for the business operations.
thank you. And first, order of business will be approved the agenda. And I would like to, I request a moment of silence for board members who have employment activity last week, and we will have that approval.
Thank you. Just I have a question. I noticed that all of our agendas now, not just here but in other committees, we don't have public comment. And I know we have a written component to it, and I know we have COVID. And I'm trying to get my head around how we have access to public comment when we have this issue. But all of our agendas now say no public comment. I'm a little concerned about that. How do we get to now? How do you have access to
I believe there are no public comments at your convention. Did you want to address that?
Well, is Joe Rosso on the phone?
We don't necessarily need to figure it out right now. I just want to kind of have an agenda item note that, and I think we as a board we start how we provide more access. This is a technical issue. You know what I mean? We don't exactly figure it out now, but I am concerned about this as a possible track.
We are working towards it. And our hope is we can allow that public comment. It is a board decision, so whatever the chairmans decide, we can do. We've worked through a lot of technical issues. It continues to get better. And, for example, we did our statutory public comments in a separate setting so that people can come in and record. So we're working on different ways so that people can remain safe and we can do this.
I think there is always public comments, and they're working through the clerk. I see the Henry Travis go upstairs, and then they can also call in. So I think at least I can just answer for our, we did discuss that, and there is those avenues for public comment. Okay. Motion to approve. Moved by seconded by Amy. All in favor, say aye. Aye. Vote carried. Moving for the minutes of the May 12th meeting, and I want there should be one addition to that May 12th meeting. Dean McKee was present on the staff item that he was on the top, so I want that included. With that addition, initial approval. Motion by Supervisor Hutchinson and seconded by Dillon. All in favor? Vote carried unanimously. Now, with that comment, we will have a moment of silence for the Edward and all of the people that are right at the point. thank you everyone for your attention. With that, I think everybody knows that our board members are my committee committed to that to do last week. In observance of his memory, next Tuesday night, next Tuesday night before the orientation, or after the orientation, 3 to 5, and Vince is going to expand on that a little bit. We are going to have a tree planting ceremony out by the, just to the right of the memorial grounds, War Memorial Grounds out here. I was out there at 8 o'clock this morning with Norby, and I think we're going to have a red maple, leave our nursery here in Folsom Lake is kind of expanded in. We'll invite the family. That'll happen at 5:30 next Tuesday night. We're going to invite the family in, and we'll also have a note before our pledge allegiance. So I think anybody that has any comments on that can have some written notes or anything we want to do for the family. We will also have a plaque. Our former board member Larry Jepson is preparing a plaque. I think it's even going to have Jim's picture on it, and that'll be a presentation to the family and then stay out in our crowd here. Just a note on that. I want to tell you how personal Jim was to me. I met him when he was about 16 years old. He was playing football. At that time, Centurion also played Tuesday. They each had their own high school. Milltown was 11-man football team, and they were in our St. Clair Valley Conference. Centurion, Somerset, and they had 9-man football. And I was out in Somerset watching the game, and my God, he was just Patrick Centurion. He was about the whole team, offense and defense, and got to know him and meet him after the game, and we got to be friends. He worked in a gas station then at Centuria, and they were a pretty popular place, Jay's Diner, I think it's down in St. Croix, over the holiday, and so we go there, so that was a meeting place for school kids and that. And then Jim Miller owned what is now called the Dallas House, and that was and the name of it was Steamboat, and there was a four-lane bowling alley underneath the main floor, and he got me an album set pins on Saturday and Sunday night. And actually, we got a penny a frame for 30 cents a game. That was gas was 19 cents a gallon. We were rich. And Jim went to the service, and when he came out of the service, he worked for WIC in Richmond, and I was managing softball league, and they scored down there, and so he bring everybody up to date on that. And then they used to haul cattle in these cattle trucks, and Jim was the first one that I knew that came out with these trailers, which I see all over now. And so he started hauling cattle with the truck and trailer, had a big farm down in Farmington, and we just had a great time, and they did a lot of fun things. Just a little history up to date of how everything was done on the past. Bill, you want to tell about something when your school board together?
Jim was good friends with Jerry Hingle, and
I remember when I was teaching, the kids were going through school, and they were all athletes. And I remember them coming down, and I was telling you, make sure you play my clips. And okay, whatever you say, and we had fun. When I switched from being
teacher immunity to becoming the principal. It was really ironic because Jerry came to my house a week before the school board meeting. It's a true story. My wife will attest to this. And they drove in the yard with their wives, and they were in Jerry's car. And Jerry pulled up and he rolled the window down, and we happened to be cutting the grass. And Jerry said to me, "Is the other thing you want to be the high school principal?" I said, "Well, I think I made it through the interview process." And he said, "Well, we certainly would like to keep you as a teacher and a coach." And then they drove away. My wife said, "What is that about?" I said, "I have no clue." So we got to the board meeting the next Tuesday night, and Jerry Henrich made the motion, and Jim Edwards seconded it, that I would become the next high school principal. And to this day, I'm still trying to figure that out, what that all meant. But, characters. Jim's son Steve lives next to me over in Centuria, so we spent some time with him. And they do have a private burial service today in Centuria. That would be this morning. So, I've got a lot of good memories of Jim. He used to come to the house all the time with his cattle truck. Yeah, with his cattle truck.
Certainly, appreciation time on the word. Just shows that there are people like that in our community. And even similar like all kinds of people. It must have been pretty good support on a Sunday afternoon. I have to be at that place care of balls that can take place. So errors and appointment teachers have to use it. The initial was kind of part of my life, and I was a teacher.
I'd like to say one other thing, John, speaking of that. When I was teaching, I was also the head negotiator for the teachers group. There were 100 teachers, and Jim and Jerry were leading the board for negotiations. So I always had black and blue marks on my forehead from helping Jim with those to a negotiation. And we had a good time, and we always got along. I remember
Jerry Evans was also one of the board chair. You were there,
we always finished our negotiations, whether we went in to the early morning or not, and then I always made them buy breakfast on the roads to food. It was 2 or 3 in the morning.
Anybody, we did have that like that very much around the big day of every comment. You're welcome. So anyway, taking care of all of that, let's move on to I'm turning it over to you.
Looks like we're on number 6. Supervisors not seated on the meeting.
You want to put an announcement and information?
Well, and that's any board members with announcements or meeting information. I don't think that we've been going out to very many meetings lately with the COVID, so everything's getting canceled. Unless anybody has attended any meetings they want to share. Okay, moving through.
People that are on the phone, that are on the committee or visiting, do you have anything out there, anybody got anything to say? Dr. Rogers, are you on?
I am on, yes. The Hickory Regional Medical Center is slowly opening up for patients. As long as we wear masks and face shields.
If there are no more announcements or reports, we will move into number 8. Department annual reports. And so last month we had given out the community services piece of the annual report. And we did ask Dina, Andy, and Chad to give a little bit of a report on what their 2019 looks like. So I think we can start with Dana. If you're ready, Dana.
Sure. Hello, everybody. Can you hear me?
Yes, very good.
Okay. So I don't have anything formally prepared to be distributed, but I can give you information on 2019. So 2019 audit is not completed based on delays with COVID and they're working remotely and everything's going electronically. So that audit is now complete. However, based on the county financials, I can tell you for 2019 we're about $100,000 in the black, so that's great news. Despite a lot of challenges over the last, just looking at 2019, census staffing, census for 2019, we were at an average of about 80 residents. We adjust our staffing accordingly, which shows in the financial piece of things. With the staffing shortages, the CNA staffing shortages that we've encountered over the last many years, we adjust our census based on the staffing more so than the other way around. So, with those 80 patients, we have a mix of Medicaid, Medicare, private pay, some other private insurance, things like that. Our biggest payer source, of course, is Medicaid. Medicaid is the payer type that pays the least. It's hard for us to cover costs with Medicaid. Medicare is the biggest payer, and that's those people that are coming for short-term rehab. We have anywhere between 2019, our average was about 5 to 6 patients per day on Medicare, so that's where we like to keep that to maximize those revenues. And then, like I say, we have other private pay, private insurance, those types of payers out there as well. So 2019, we also got a new boiler for Golden Age, which was a big deal for us. That had been talked about for a long time. So that, was in place and functioning, so that's great. We've been here in this building for about 61 years, so with that comes a lot of capital needs, and we have a great maintenance team. We have over the past, I've been here about 9 years, I guess to give you some background. We've had a good maintenance team in place that continues to keep up on the building, make those repairs. We've done, in our capital budget, we have just some kind of room remodels, more aesthetics, flooring and paint and just all those sorts of things that go into keeping an old building up and running and looking good. So we continue to do those sorts of projects as well. We continue to work with legislators on funding and staffing and, all of the things that go along with that. So lots of issues there that we work with our state association leading in Wisconsin. They do a great job for us lobbying and helping us to give those messages to our legislators. So questions, I guess that's kind of a quick overview of 2019. Questions from any of you?
Well, then I think the outstanding thing in your budget is how, in 1959 building, 61 years old, how you continually made improvements, capital improvements, and Dana, doing it, or Supervisor Netherlands, Administrator Netherlands, you just want to explain a little bit about the whether that has to do with
that comes out of our operating budget, or our county budget, and as do any type of capital improvement. So going forward, any types of things for that building structure needs to happen comes out of the county budget, or comes right out of the budget.
Exactly, a loan, is it to the loan aid? Don't they make some payment?
No, I think that comes right out of our budget, yeah. So, but Dana does a great job of operating in the black. We do receive a lot of funds, and correct me, Dana, but we get $1.2 million from the state to help us run that. But there are always challenges. I think the key, she said, now going forward, she mentioned how we have Medicaid, Medicare, private pay, the Medicare being the best payers, so to speak, but those have been cut dramatically in 2020 because of COVID, because surgery, they do it, whatever needs to be done, and then rather than shipping them out like they have in the past, they keep them because they pay.
Yeah.
So Dana is dealing with a shift in the type of payment they're receiving as well as a drop in census.
Right.
I remember how unique the county health programs are. I remember, Joe, you and I were at a seminar at the Wisconsin County Association, and we were surprised about how many counties actually had nursing homes working. And I think the whole county was, they talked about the cost of their operation. And when we said that we were in the black on our nursing home, these other counties were pretty outstanding. I remember one county said, well, yeah, they finished theirs in the black, but they dedicated their funds from sales tax to their nursing home. So it's pretty unique to have a county nursing home in the black. We really appreciate that.
I will mention too, and as I'm sure you all know, being on the board and whatnot, but we are not on the tax levy at all. We get zero tax levy dollars. A lot of the nursing homes, county nursing homes in the state are on tax levy, so that's unique as well. Also, just to touch briefly on COVID, for some of you that weren't at the orientation meeting earlier, we have been successful in keeping COVID out of our building to this point, so that's been a lot of work and a lot of changes to our flow and how we do business here. And like Vince was saying, admissions have dropped. You know, they're kind of picking up again based on, like Dr. Lager said, hospitals seeing more patients, but it's still a struggle with families. We're still not allowing any visitation, so if people are able to keep their loved ones home, that's what they're doing at this time. So, any other questions?
Yeah, I also wanted to tell everybody that when I first got on the board, I took Neil Johnson's spot, and he was on the committee there. We had all our meetings there. And I kind of took you under my wing. You were special because you were so out helping people and keeping everything spotless. I mean, when we were in the boiler that was that old, you could eat off that thing and you could eat off the floor. And it takes a special person to do that, and that is you. So thank you very much.
Thank you very much.
Thank you, Joe. Tanya, back to you.
Okay, Andy or Chad, which one wants to go first?
I can go.
Okay.
All right, so I'm going to report on 2019 for our office process on the different activities. Let's start with power of attorney. There should be some material included, hopefully. If not, I'll just kind of go through and explain which activity or what the meaning is to it. So I see something pulling up now. Okay, so for 2019, power of attorney, what that means is essentially new customers, whether it be a veteran, surviving spouse, we have to assign what's called a power of attorney. So a veteran service organization to represent them. We had 164 new customers. Disability compensation claims, 185 new claims for 2019. Disability compensation claims, what that means is if there was a injury or illness that occurred in service, we filed a claim to try to obtain service connection for that disability. Disability response letters, that's this correspondence back to the VA. The VA does have a pension program for low-income veterans, so we did 4 pension claims last year. What that means be any veteran below the poverty limit. So that pension brings their income back up to that poverty level. Pension response letters, just corresponding back to the VA, responding to a letter. DIC, that stands for Dependency Indemnity Compensation. And for 2019, we did 6 claims for widows. Essentially, if a veteran dies due to a service-connected disability, or if they were 100% service-connected for 10 years, that widow is entitled to that benefit through the VA. Right now, the base pay for that benefit for the widow is just under $1,400 a month. Widow pension, kind of the same thing as the non-service connected pension that I had mentioned above. That's for the widow to see that widow's income brought back up to the poverty level. Notice of disagreements, division review. So that's appealing denial from the VA. So in 2019, we appealed 48 denials. And then same thing with the next one, BVA appeals. That's an appeal to the Board of Veteran Appeals. So for 2019, we did 5 of those. Insurance claims, GMCA, that's a benefit for surviving spouses or spouses of 100% service-connected veterans. For 2019, we got 20 widows or spouses enrolled in CAMP VA insurance. Burial benefits for 2019, we did 20 applications for reimbursement for burial and funeral expenses. The next one, government marker applications. That's the headstones, markers that you see in cemeteries, whether they be an upright marble marker or a flat bronze marker. We did 36 applications for that. Flag applications, we did 4 of those in 2019. Education benefits, whether it be state or federal education, we assisted with 5 education benefit applications. Vocational rehabilitation, we didn't do any of those in 2019. The loan guarantee program, let's see here, 2019 we did 13 of those. So with that, the VA they don't do home loans or anything like that, but what they do is they essentially back or guarantee a mortgage where if the borrower defaults on the mortgage, the VA will pay 25% to that mortgage company. So it's kind of an incentive for mortgage companies to either borrow to a veteran that might not have a very high credit score. Other than that, it eliminates down payment. There's no private mortgage insurance that the veteran has to pay with that program. That waiver request, for 2019, we did 4 of those. That's if a veteran is low income and they are being billed full pay through the VA. We did 4 requests that their debt be waived. Medical enrollments for 2019, we did 70 new healthcare enrollments with the VA. Waiver requests, so we did 6 of those in 2019. That's if an individual is over income. We can submit a waiver request to the VA to get them enrolled in VA healthcare. And then moving up to the right side, we didn't do, well, let me back up a little bit. The Wisconsin Department of Veteran Affairs, they have 2 grant programs, each veteran grant. One is a dental grant. So if a veteran needs dental work, dentures, things like that, Wisconsin does have a grant program for that. For 2019, we did not do any applications. We refer a lot of veterans to The dental clinic that is now in Turtle Lake seems to be very reasonable for them with the sliding fee scale. The next one down, the substance grant, we did one application for that in 2019. And we're currently doing more of those right now due to COVID-19. The Wisconsin Department of Veteran Affairs has changed their guidelines on eligibility for that. If someone has lost their job due to COVID-19, they are then eligible for that grant. Right now that pays up to $3,000. So it kind of helps bridge that gap for them being out of work. The next one down, state eligibility. That's just different things throughout the Wisconsin Department of Veteran Affairs, and it lists down below. So for the Park Pass, some veterans are eligible for a free Wisconsin State Park Pass. We did 6 applications for those in 2019. We did 34 applications for the property tax credit. So if 100% service-connected veteran owns property, they can be reimbursed for their primary residence and up to 2 acres of land for their property taxes. So this is a great program for Wisconsin veterans. Wisconsin driver's license identifiers. In 2019, we did 44 applications for that. Wisconsin DMV has basically, it's just you can get a Wisconsin driver's license that says veteran across the top of it. It's good for any discounts or, businesses on or veteran discounts. Wisconsin GI Bill, that's an education program through the state of Wisconsin. We did 7 applications. We did 49 applications for SF-180s. What that is that's to the National Archive down in St. Louis. So if we have a veteran that, their discharge was destroyed or lost, they need their records from when they're in the service, we can obtain all those records from the National Archive. So we had 49 of those last year. The next one down, verification letters. So that is income verification with AMIR and energy assistance. We did 45 of those last year. Veteran assistance program. We did 1 of those last year. And then, let's see, we do a lot of miscellaneous for federal. That could be just calling one of the VA departments on a veteran's behalf, checking the status of things. So, and another thing that we have is telehealth. So, veterans can come into our office and utilize our telehealth, so they can meet with their doctors through our telehealth system. And I believe we had more than just one, so that number I don't think is accurate. Any questions for me?
Are you getting adequate transportation refunds for transportation for veterans?
Can you repeat that, please? You're just cutting out a little bit. I'm sorry.
Are you getting refunds for transportation for veterans?
So we do receive through Wisconsin Department of Veteran Affairs for transportation, but we go to the Aging and Disability Resource Center. We essentially just hand that over to them. Since they run that program, we use that to offset the transportation costs. If a veteran is entitled to travel pay, they're required to surrender or give that travel pay to the Aging and Disability Resource Center as well. If they're not entitled to travel pay through the VA, there is a $30 copay for them to use that transportation program for VA medical appointments.
Well, then, that's an outstanding report. Any other questions? Okay, Tanya, you want to move on?
So before we have Chad give his report, there's two new callers, so we would like user number 7 to identify, please.
I'm sorry, what?
Can you just identify yourself if you're caller number 7?
This is Rita McKee. I couldn't get online at this meeting.
And then there's one more caller, if we can have you identify. Thank you, Rita.
You're welcome.
Well, we'll go ahead and have Chad Hoyt give his 2019 in review.
Good morning, everyone. As we prepared for this meeting today, I knew that we were doing the orientation this morning, but our 2019 annual report isn't quite done yet. But I can certainly kind of give an overview of what our 2019 looked like. As I mentioned during the orientation meeting, the transport agency is housed under the Corporation Council, and so when it comes to the budget matters, our budget is really intertwined with the Corporation Council, and so therefore our budget in matters of that nature don't really go through this board, through the Health and Human Services Board. And so our job here really is just to kind of report, since we do deal so much with working with economic support and getting people on health insurance and those matters. And so just kind of as an overview for last year, really the highlights were the fact that we were able to hire 2 new case specialists. We've been short-staffed for much of 2018. In 2019, in June, we were able to hire a staff member who had 20 years experience in child support coming over from Minnesota. And so it was great to kind of have that knowledge base of how Minnesota and their child support works, since we do have many cases within our agency that we're enforcing on behalf of Minnesota, or we're asking Minnesota to enforce on our behalf. And just having, over 20 years of knowledge there. And she did say it was a bit harder of a learning curve than she expected it to be, because she was so knowledgeable of how Minnesota did things their way with different statutes on their level and calculations, that it took a little more to kind of retrain her brain to do that. And then we hired another specialist in September, and it was great to have full staff finally once again within the agency. I guess real quick to touch on budget things, for those who may be new, the majority of our funding is through state and federal funding. Approximately 86% of our expenses are reimbursed through federal and state reimbursements. And so, when it comes to the child support agency, it is one of the most efficient government programs out there. On average, let me just kind of give you some really important statistics. For 2018, in the state of Wisconsin, in the Polk County, was very close. I haven't had a chance to calculate ours yet, but for every dollar spent on our program, we collect $5.77 in child support that goes out to families in our community. And so, that's a great, a very efficient collection rate that we have to again, collect money for those families in our community that need it. Just kind of looking through some of my notes that I may be able to, instead I wasn't prepared to give a annual report for this meeting, so I apologize. Are there any questions that I can maybe answer if anyone has some?
Jen, I think that's a pretty substantial recovery rate as far as child support dollars go.
Yes, we're quite proud of that. Again, with Polk County rates right around that same, we may be slightly higher than that, closer to a $6 range. Once I do get our annual report together, I'll be sure to properly provide it to the committee. Just on a whole, kind of as Wisconsin, we are ranked fourth in the nation in collecting current child support. And for an amount that's $933 million in the state of Wisconsin. I realize that's not Polk County numbers. Polk County, on average, collects about $283,000 per month in current child support.
That's quite outstanding. Appreciate your dedication, sir. Any other questions for Chad? If not, we'll move on. Tanya, do we want to move on to Danny's report on the corners?
Yes.
John, when you start off there, maybe you can bring us up to date a little bit on some of the history. I remember for most of my life, a doctor used to be the medical examiner, and that was quite interesting. And so there wasn't a full-time person, and I don't remember the timeline, but probably about 20 years ago we went to a full-time. How long have you been with us now? Just touch
should be a green question.
turn on green.
Well, I'd love to give a history on the medical examiner's office. I was your last elected coroner and your first appointed medical examiner. That all happened back in I was elected coroner after Dr. Simon was there. That was 20 years. I believe his father had done it for 20 years prior to that. So Polk County has been fortunate that we only really have 3 coroner/medical examiners in the last nearly 60 years. So that's unusual, that's for sure.
You also have an assistant now?
Well, we actually, we have 2 deputy medical examiners. I'm not full time. I'm about 1.75, something like that. And then I have 2 deputy medical examiners. We're responsible. We 3 are responsible for covering the county 24/7, 365 days a year. This county and you'll remember this, Mr. Chairman, we switched from the coroner system to the medical examiner system back in, would have been January of 2005, as we made that change. And the change was made mainly because, anybody could run for coroner. Anybody could. There was no qualifications, there was no minimum standards, there was no anything. I mean, if you got your 200 votes or your 200 signatures, you could be on the ballot. You could be on the ballot. So, I was fortunate enough to work under Dr. Simonson for many years as a tattoo deputy. And then when he passed away, I took over as the coroner at that point. So I think maybe a couple more brief things. In the state of Wisconsin, and some of this is in your handout page, in the state of Wisconsin, Tony, with a population of 500,000 or more, must have a medical examiner, and those must be physicians. And almost all of those are going to be your board-certified forensic pathologists. If you're under that, each county has a choice. Do they want to have an elected coroner, or do they want to have a medical examiner? Most are changing the medical examiner now. There's still a few coroners, but most are medical examiners. And the reasons are really quite simple, I think. And that's that you've got some control, you can set minimum standards, you can, set expectations where you couldn't have done that with the coroner. Number one, I went through, that is we are a legally, statutorily mandated office, and we're guided, I suppose, under Wisconsin State Statute 979, and that covers most of our responsibilities. And I kind of listed those on the first sheet. I'm not going to read each one verbatim. I'll let you read that at home. But it's good reading. Right now, as I mentioned, I've got, it says 4 deputies, but actually it's 3 deputies. Or 2 deputies. Well, actually, officially it's 3. Mary Ritchie from Barron County helps us out every once in a while, too. For 2019, I would like to spend a little time on our 2019 year. This, unfortunately, was our biggest year. We've had record years every year for the past 5 years. And that's disconcerting, but, hopefully this year, 2020, is going to be a little bit better. Hopefully we'll reach our peak as far as the caseload goes. This year, so far in 2020, we're down 20 cases from 2019. So to me, that's a good sign that things are stabilizing a little bit. But in 2019, this page right here that's got the statistics on it, a couple of things I just want to bring to your attention. You can see the male gender outgroup of females. More men die than women, at least from the coroner, the medical examiner's standpoint. We did 18 autopsies. Each autopsy runs $2,000. We have a contract with the Midwest Medical Examiner's Office in Anoka County, Minnesota. Used to be, maybe a couple of you might remember Janice Amatuzio. Amatuzio was she started this, and she's now retired, and Dr. Quinn Strobel has taken over her position as the chief medical examiner. So our county contracts with their county to do our forensic pathology needs. It's up to me really to decide who gets an autopsy and who doesn't. For the most part, that's relatively straightforward. Anybody involved in legal cases certainly is going to get autopsies. Somebody who you really have no clue why they died is going to get an autopsy. But I have to use some financial judicious behavior, shall we say. I just can't autopsy everybody. Even though there are times I would like to, we can't do that. We don't have the money to do that. So once in a while we do run into a case, where families absolutely want an autopsy on their loved one. And my general response is, I understand your concerns, and if you want an autopsy, you're more than welcome to get an autopsy, but I can't pay for it. And many times, as soon as the family finds out that they would be responsible, they change their mind, they don't want one. Other times they have done it. And but that's fine. We will assist them. I would certainly assist them in finding an autopsy for them. Not easy though, because there's many pathologists that don't want to have anything to do with private autopsy. But that's a big chunk of our budget. Our autopsy. We have a contract again with Midwest Medical Examiner's Office. We pay them, I believe it's $36,000 a year. Every 3 years we review it, and basically we come to an average of the cost, of how many we get.
That autopsy thing, that's really interesting. I see a thing that I just hear for an average, and that is something that is paid right out of the county board budget.
Yep.
And so it's John's first question, and I know that's a controversial thing with the public. Well, did you have to have an autopsy or not? Because everybody knows the taxpayers and you give the permission. And then, well, why did you have one and we didn't? And the autopsy, a lot of times I think you have to have that because of insurance claims and things like that.
It would really be more legal issues than anything else.
Right.
You really want an autopsy. I mean, I'd rather go into court with an autopsy report from Dr. Strobel as compared to my report. She carries, I'm a big guy, but she carries a lot more weight than I do when it comes to that. So it's really to protect the county and to really give some answers. And, Dr. Amatuzzi always taught us, she was my mentor, she said that the purpose of an autopsy is to answer every question before they're asked. And that has come in handy many, many times.
I remember Dr. Amatuzzi had a very exclusive video of what an autopsy is. And I personally never want to do that.
Yeah, I agree. Couple things over one that I'm going to accidental death. We have 25 deaths classified as accidental. So you can look over there, there's a bunch of different things that are classified as accidental. The leading cause would be motor vehicle fatality. Clearly those are accidental. Actually this year, or in 2019, we had 2 motor vehicle accidents directly related to methamphetamine use, which is very unfortunate. The next big cause, interestingly, is complications of a fall. These are classified as accidental death. This would be your little lady or your little gentleman who fall and break a hip or suffer a head injury and never recover from it. Those are classified as accidental deaths. And it's really more for a statistic person in the state of Wisconsin. We want to know from public health standpoint, why are people concerned about falls? Well, I'm here to tell you, the older you get, the more concerned you need to be about a fall. Next we have the 2 drownings, and then you can read through the rest of those. We had 1 homicide last year. It didn't get a lot of attention because it wasn't your typical homicide, but it was certainly part of the worst case of elder abuse that I have ever dealt with in my career. It was awful. And because of the fact that this individual was so neglected, that it was the neglect that led to the illnesses that ended up causing the death, so that officially classified as a homicide. I believe it's been adjudicated been in the newspaper, so I'm not saying anything that I don't think I can say. Natural deaths, we have 384. That's going to be almost everything else. What I can tell you is the leading cause of natural death in Polk County continues to be heart disease. That is consistent with the state and with the nation. Second leading cause of death in Polk County is complications of dementia. You see a lot of that. Third cause of death is going to be third, fourth, and fifth are going to be combinations of cancer, which would be mainly lung cancer, colon cancer, and breast cancer. Those are all, then there's a number of different other cancers. I didn't separate those all out. So leukemia, it could be anything, melanoma, it would fall in that category. Colon cancer, suicide, the other thing we get involved in all the time, suicide, do require the notification of medical examiner. We have 7 suicides. And the one thing I really want to point out to you is on the gunshot wound on the bottom, if you look at that, look at the ages. The ages are consistent with what is in the state and in the nation. People think that, initially, most people think that suicides are young kids or 20-year-olds or something like that. That's not the case at all. Overwhelmingly, the suicides are elderly for multiple different reasons: financial issues, health issues. They're by themselves. They don't have a family. There's depression. In the elderly that goes untreated. Unfortunately, it's a very common and sometimes underreported and under-talked about issue. So in 2020, as we move forward, as I can tell you, as of this date right now, we are thankfully slower than we were by 20 cases last year. My hope is that it continues that trend. Is there any other questions that we may have on the medical exam, maybe on the medical exam system, or on health, or anything else? Cases we get involved in.
If you have any questions, for any of these that you're allowed to ask any questions. John, you've done a wonderful job, and I thank you for the service to Polk County.
Well, I appreciate that. I appreciate the honor to getting to see the Polk County medical examiner. I mean, we've worked together for a long time. My goal now is I'm going to beat Dr. Simonson's record.
I was just in a death report.
Really? Okay, I thought Dr. Gunn was 20 years. We'll have to look that up in the history book. My wife won't be happy if I don't do 20 years. Thank you very much.
Thank you. Not yet.
Okay, moving on. Ryan, do you want to kind of tag team a COVID update?
Sure.
Want to come up?
So just a brief COVID update. I think the total cases right now, stand at 32. I believe we've had 14 recovered. It should jump up to 16 here. A couple folks are going to get off their isolation period here relatively soon. Currently, there's of the current positives, nobody is hospitalized. That's good news. We did have an elderly person who was hospitalized briefly, but they have been released, so that's very good news. Really the biggest issues that we're focusing on right now, other than the contact tracing and identifying particular public health nursing duties and the capacity to keep up with it, is we're looking to ramp up community testing. And as we ramp up community testing, we're going to see increases in the number of people that we need to contact trace back onto and then monitor. But one of the new requirements that's coming down from the state is, of our positive cases, we need to have contact with them twice a day. another one would be a check-in that they can do on their own on a secure website. So of those new requirements that are coming down the pipe, it's going to take increased capacity and resources to do that. The other thing in the communities that we're dealing with, it used to be businesses calling and asking, when can I open, how can I open, what restrictions might be in place. That's kind of being replaced now with our school districts, looking in terms of what happened past June 30th. June 30th was sort of the line in the sand for school districts to, pretty much shut down operations until then. And that date is fast approaching, and what's that going to look like starting July 1st, and then the potential return to school. So we get a lot of calls for technical support on, here's our graduation plan, provide feedback. Here's our plan for summer school. What do you think about that? Can we do summer athletic training in anticipation for all sports, and so on and so forth. So that's what we're spending a lot of our time with, is kind of that technical support about how can we do those things safely.
Well, I just wanted to speak on that, as far as the internal operations here, for the county. We are working with the administration on our reentry plan that was sent out to staff yesterday. I believe June 15th will be doing some limited services, so offices and staff still recommending by appointment only. We will have some walk-in. We have seen that our walk-in traffic is increasing. You'll notice that we do have a receptionist sitting right out in the main area there, trying to triage people, screen them for COVID symptomology. So there is work on our end as far as continuing to serve the public in whatever capacity we can. For community services, we have a home visiting protocol that we rolled out that has some built-in safety features, checking people, masking, sanitizing, just really focusing on the universal precautions that we need to have. Social workers, home visitors, and the family space. And back to a grant question in our organization, I wanted to know about open positions. So with COVID, we have not done home visits. And there's been a lot of time realized in travel. We do a lot of travel in our organization. So what we've done to be able to save some budget is projected shortfalls in not full positions or reduce hours of staff because we don't have that. We have extra time to be able to do that. But once we have the demand for the system, we'll be back up. We look at those positions so that's still and especially in the end of the business. We have some private on.
So I want to open it up to questions while you're there, because I've got a lot of calls from constituents myself. First of all, just to stress your time, you're our Director of Health and Human Services, and Brian, you're actually the official health director.
Right, so Tanya is the director of the community.
And Brian Haas is
environmental
health. So I was at the Fair Board meeting last Thursday night, and the fair, of course, they voted to cancel the fair for 2020. But the fairground was actually covered access, rented out for, I believe, past year, except for 2 weeks around the holidays. And I got some calls. For one of them, there was a horse show event, and they had to find a public. They chose to find a public place because they didn't think the fairgrounds for parks and fairgrounds was open to public. Can you answer that?
We don't have restrictions on in-person parks and things like that. In terms of events being held there, we'll always work with organizers of events that propose to have large gatherings and things like that, but we don't have any restrictions per se in Polk County in terms of whether or not that can happen. We will always work with them as they're developing their plan to make sure it's as safe as possible.
I've got a lot of calls from people that thought the school district like the track but those restrictions would be all up to the individual school district, or does the state have anything to say about that?
The school district's June 30th date survived the lifting of the safer at home order. So when the safer at home order was lifted, the restrictions that were in place for school districts, they stayed in place. So the school districts really don't have a say on what happens on their grounds until that date.
That was the answer. Thank you very much. That was the answer that I got from the superintendent that I talked to, that their release date was June 30th, and so that was their answer, and I appreciate that very much. I think we can clear up a few things. Amy, do you have a question?
So my question is maybe a little bit global, but so the virus hasn't changed its game plan, but we have. I've noticed that there's a lot less masking, a lot less social distancing, et cetera, et cetera. And then I read the piece about the Burnett County softball, baseball tournament, and they found strategy. Yeah, a lot of people tried to talk how we go in, that back and forth this plan. I'm just kind of curious what we can do to kind of message this, the virus is still active, it's still around, it's not going anywhere. We might have found someone else in our thinking about it because of the virus, but it's still an urgent issue, and I don't want us to have another surge and all of a sudden. On that, and I think about okay, we got in what has been pretty far. Well, hospitals are in cities and those should hospitals here. So to shift to taking care of everybody in one place topic. If I think about this larger byline up there, and I just had to focus on here. It's still alive and well. So if you're just getting some problems, you might not even take problems.
Well, fortunately, we've had really good communication with our community in terms of, I think I've got calls and requests from every community on, we're thinking about doing this, what do you recommend? So that communication channel is open. The other piece of that is, I don't think we can do enough public education. So the lifting of the order is gone, the virus is still here. So we try to push that as much as we possibly can. Reminding people that it's still out there. You're right. I think the awareness piece has kind of gone down a little bit because there's been other issues in the news cycle. But the concept of, our biggest message is we know that people are moving about more, and that physical distancing, the 6-foot rule is really the key. And if you can't maintain that, the masks are recommended at that point. So the CDC strategy, the state of Wisconsin strategy has shifted from that initial, we're going to send everybody home and we're going to try to minimize the spread of this. It's pretty much accepted that there's moderate risk everywhere right now. So the assumption that the virus is in our community is accurate. So now they're looking at changing the focus to, we're going to ramp up our testing, we're going to identify positive cases, and we're going to try to make it. That's the shift in strategy.
My question, so when you were talking about spreading that education, how do you get that message out?
We'll use whatever we have available to us, so our traditional forms of communication, social media, we push that out on social media to the extent possible. And then as we send messages out, we push them to our healthcare partners as well, so that we're all sending the same message at the same time, because we know that mixed messaging can really monkey up the water, so to speak.
Brian, in part of the media, does the media in general have any information that would be advantageous to the public?
We're usually contacting our they're contacting us back and forth on a weekly basis, whether it be just for an update or a statement on a number of cases, so on and so forth. So every time we push a message, the media is included in our distribution list, and then it's up to them to take it and run with it, how they choose. But we've had pretty good response from media. If we push something, if we push a message to them, it's usually getting published.
I know Wayne Lebecky from the WIAA was a representative out of Alma, and I believe August 4th, they can start athletic training for the fall. I think the 13th is
the fall practice. Yeah, fall practices can start on August 13th. The issue now is, what can we do to develop our athletes between now and then? And it's not so much WIAA guidance on that. There's another organization above them called the National Federation of High School Sports. They're the ones that push the guidance down to the WIAA on what they can and cannot do.
So there's a lot of virtual strength and conditioning classes going on right now.
Yeah, really the biggest issue, I have experience with this in that I've trained athletes before, is the free weights, which is what most schools do. You can't spot. It's because I can't spot from back here when he's got 400 pounds on his back. Not recommended. So what they recommend is individual type training, body weight resistance, and submaximal lifts.
Do you have anything from the press back there? Are you getting pretty much the same results to push the media guidelines? That's important. I sure want to thank you, and I think you answered some general public questions that we needed to know.
I think our messaging is that we want to make sure that people know the virus is still here, but we also don't want to scare people because we do have to adapt to a new way of living. So it's that fine balance of, keeping yourself safe while realizing that it's still here.
I think that the carrier is going to not be anything to add.
For the COVID, no, I think we're good.
You've been in touch with Brian, and you pretty much told everybody here.
Yeah, he's off this week, but they're still doing the things that they're doing with their licensed and regulated entities, and they field a ton of calls from businesses on technical support. Thank you.
Number 10, Administrator Sutherland, I think maybe you should
Regarding
anything in general.
I would just say I want to thank the health department, Tanya, Brian. This has been an ongoing challenge, and since the lifting of the stay-at-home order or safe-at-home order, I think our goal has been to educate. We've been sending out information. We've worked with businesses. We put together a Business Recovery Act, which emphasizes best practices on how to keep customers, vendors, and staff safe. And we will continue to do that. And I know Brian has done a good job talking about the virus is still here. So we want to make sure that we're doing everything we can to keep us safe, but yet also recognizing the rights of folks to, with the weather, people are getting out.
We'll leave it up to you to get the activity permit work out and generate that back.
And I will say this, I'll emphasize, if the county doesn't decide what events go on or what businesses are open, that's their individual. What Brian has done, and we emphasize, is we can give them suggestions as to how to keep people safe and what the risks are. So, have you seen the fairs canceled? Many of the summer activities and festivals are canceled. Those aren't our decisions. Those are decisions local people make based on the information that we gather from us, from the media. everyone else.
I was at the Fair Board meeting, last Thursday night, and, they voted 13-1 to, cancel the 2020 fair. And that was basically based on, there was other candidates in Craig, I think all our neighbors. I don't know if there's any fairs live, there probably, but the Wisconsin State Fair, canceled prior to that, and that was probably a big determining factor. And the 4-H kids and the things that really affect that stuff, they've been working on these not just a year at a time before, but that's their career. These county books, 2020 county books are available for the supervisors. You all have one in your mailbox, and there was about 20 of them there this morning at 8 o'clock. And I was there, and I was going to grab one half an hour later so each one would have one. And they were all gone. But if you go to the clerk's office, everybody that's on our board, and for Dr. Rogers, Rita, and all those in correspondence, kind of get one of these Polk County 2020 official directories. Lots of information in everybody's name and correspondence. Thank you. I'll let you wind it up, Tanya.
You have our item here, like whole updates, and we wanted to bring that back. Providing a little bit of education on how the whole will work with our human health factors ordinance. That's the number 2-0-0. That means it was the second ordinance of the year 2000, so it's a little bit old, but it still is what we need to follow. So the human health hazard is how the public health department currently is involved in the people issue that is going on in the environmental services and commission. So it's a process that we have in place to be able to respond to not only our people complaints, but any type of complaint that will rise to the level of human health hazards and how to deal with that. So examples of what will rise to a human health hazard, make carcasses of animals or not intended for human consumption, and they are not buried or disposed of correctly, so they are out in a fuel or somewhere for a time period in which they would start to become rotted and vermin and that type of thing setting in that would rise to that level of hazard. I don't know what the time period is on this. Brian did have to run to another meeting, so I'm going to get this one. The next level of health hazard is waste. So if a lot of garbage and waste is on a property and it ends up going over into somebody else's property, that's where our health department goes out and does that investigation and tries to remedy it. So, carbon supply, hearing, and that type of thing. So the calls come in, we do the investigation, and then we'll go to our homeowner. Air pollution, so I think that's one kind of one of the issues with the table, the presence of air contaminants. We don't currently do a lot of that investigation. There's we work with Madison, our state partners, to be able to measure the air quality. We get sent out and then send back. Be able to measure odors, there's example, so foul, offensive, noise, or disagreeable odors. We were told in that investigation and we needed to help them. So hard to measure, very subjective, and doesn't belong in the health ordinance or the health hazard ordinance, or is it more of a we're working on this as well, but not the case. And then solid higher that solar and it's not proper hazardous material, and it's not controlled properly. You have to have a local brand, and then you want that most of the time it's working with the owner to remedy the situation rather than imposing fines and starting to working with the owner. Wastewater sewage, so there's into the lake, sewage drains the lake, and we work a lot with the zone and these types of issues for Brian Ross. There's some conscious communication with Jason and Spirit. Private school is dry water usage, again working with Jason and Spirit on those types of things. Steps for consumption and so we could do written order to enforce it for health officer Brian is the one to put that protocol. We have steps to follow. I think most of the time, like I said, we are trying to work with stuff and one of those practices. I don't know what the specific is on the number of citations that we do. If they don't comply, then we cite them, which could then be the pushing over the office on to continue the timeline. So penalties, the fines, like I said, I don't know what our fine rate is. I don't think it's very high. But we do have policies that can be able to. If somebody is not complying, we're asking them to do nothing to put our financial. So again, this is a step. They're just not working with us as a progressive to involve more in enforcement. So this is how the mental hazard relates to the staples, and I think Supervisor Middleton, you want to have some discussion on what the public health aspect of staples. I don't know if it's going to turn it over to you or how we start that there. There's questions on this one first, we can answer those.
First of all, and then we're right, we're still after the info more. Yes, that takes money for it. There is a moratorium for the tax.
Which expires in October.
Right. We do the track of that. The copy board.
We would ask Jason about
now that's something you wanted to address. I can address more of the voting side, or if you want to see sample conditions that are only environmental services. But basically right now, the environmental services committee through our office is looking at a conditional use process. And what we mean by conditional use in the zoning world is that if the property would be zoned a manner, a point, or agricultural zoning classification, and then somebody would have to come in and apply for conditional use permit to be able to operate swine, cage, 12,000 animals or more. Now, we're back in swine, and that animal unit is 0.4, and that's the numbers that we actually 2,500 days in order to hit that 1,000 animal unit structure. So if they were proposing an operation at that scale, they would come in, they would and apply through our office any conditions and that the committee has been working on drafting, and that would have to be applied up front. And then there would be a public hearing, which you notify the towns, you notify the adjoining property owners, and it's a 2-week, class 2 notice in the newspaper, as part of that, so everybody's kind of aware of the proposal up front. And the good thing about a conditional use permit, is because there's been a lot of feedback about DNR enforcement and land and water, and it just gives another avenue in that for us who's going to be able to revoke that. So there was a lot of conditions that are already implicated that may be regulated by the DNR. The DNR regulates solid waste, for example, through their WPDES permit, which is the pollution discharge elimination permit. So they would be the actual enforcement body, but then the county could also help do the zoning stuff. So that's kind of the whole background on why the committee decided to look at that.
So
the new members and the rest of the committee, I believe, I don't know if you were and Joe, you were, the, office down in Baldwin, the gentleman was at the county board meeting, and all at the very operations in that, you have to give them a permit, and he's the one that guides a violation, and so it is pretty well structured, as an oversight, and, he was very detailed, he gave him the permits, what the details were, what the consequences were. There's never a, oversight in part more or something like that. I guess he worked with me on that. We don't actually have a lot to deal with them, and that's because he works more with our land and water. What's actually his type? And then, I'm not actually sure what his title is, but he's got about 25 cable operations within his territory, and that, I don't believe that you got any swine people in your territory, but there are some swine people that go down farther, closer, like Buffalo County, that area.
So I guess what we want this group to talk about and consider is there's two kind of sides to what this conditional use permit will look like. And I think what we would be asking this board to decide is some type of recommendation to the committee, which their committee meets tomorrow, with some language to be considered, and that this committee needs to decide on what the language or what the recommendations are. And then I know that Supervisor Middleton may have a resolution that she would want to bring to committee next month, this committee next month. So, am I on with one? Yep. Okay. Do you want me to talk about the two arguments? So, with regard to the language for the conditional use permit, one of the concerns from Supervisor Middleton is the cost that the county could incur if for future studies or further research on kind of proving that they're not going to damage the environment. We have some personal experience on other boards with prices racking up on a village having to pay for studies. So you were concerned about the price rolling over to the taxpayer. And then also, so with regard to that, is it a pre or a post? So are we reactive or are we preventative? Do we have the conditional use permit requirements, the applicant to pay for that testing? They're bringing up the suggested language. So do we build into that conditional use permit costs associated with gathering baseline data and or taking it to the level of prevention, Supervisor Middleton would like to see more proving that you're not going to harm the environment. So prevention or reaction. Do you want to speak to that a little bit?
Sure. Yeah. I think when Tanya went to talk to the really, I think the comments that you made within the context of this one is spot on. That there's still requirements, things like that. But my problem is the entire ordinance is not preventative. So it's all reactive. All the stuff that we heard about in my presentation about what we do in health care, that's all like, oops, we got a problem, now what do we do? And so I want to see the entire look. But I really want it to be more proactive and competitive in the way we manage it, so that we are not as a county and taxpayers scrambling with the bill or scrambling with the cost of their money neighbor concern. Because that puts the onus on you guys. The first phone call will be coming to one of these schools, either zoning or something else. And so I really want to see us get ahead of this and say, put in structures that are preventative, then that piece, and preventative and protective of human health. So that's that. And then the other piece is that I really want to see that whoever is the developer, whoever wants whether the case or corporation is, they have to pay more than $20,000. That's what it is. The amount to answer the question about engineering, answer the question about air quality. What is the groundwater vulnerability under this site? All those questions that we're going to have, and we'll be asking them, and really be asking them. But ordinance should encompass a really clear, specific way that they have to pay for it. And I'll tell you why. Because I experienced this about 10 years ago in the town. I feel it had a hard rock quarry come in. We had no ordinances, we had no practices. We had to spend, I don't know, $40,000 to $50,000 answering the questions that we had about noise and dust and groundwater dewatering and all the questions that come with these things. So I know it's a pain right now, and I'm kind of just like teaching later. So that's where we were supposed to come back to you. This is what we're supposed to discuss, and then come back to environmental services and some kind of something or other. So instead of diving into these and torturing them with my lawn, whatever it is, 10-page document, of which save anyone thank you for it.
I feel that what I really think would be helpful is if we get this gentleman from the office involvement that issues the permits for people for the area and the other operations. And we don't really find there's no sense of having a Google, but I mean, we could sure, as a county, we could pick out some things that we want at the county. But I think it would help us all if he would explain his responsibilities and some limitations and operations of how the people structure is. What do you think, Joe? You were at his presentation.
A lot of information.
I just want to keep. We can try to get him here. I'll try to get him here at the next meeting time. He sure has some guidelines and information for us.
Yeah, so I can just give you a little bit of clarification on that. For the DNR, we definitely invite them. But this here is a completely separate permitting process after the DNR. So they already got to jump through those hoops. What they regulate is kind of up to them. You guys don't have to regulate that, or you can regulate it again, but then you're kind of throwing them up again. You know, that I can definitely reach out to them.
When you do that, and our next thing would be July. I would think that you would try to come to our next meeting. Like you said, we don't need duplications. but still involved in unique in our own, area.
What would you want from
But as a,
So I have taken a look over the different ordinance, and I'm aware that probably various communities are suffering from a little bit of case overheat. This has been going on a while, and it's something that people would like to see come to culmination. I do think also it's important that we do this right, and not that anything being done to this point is wrong. Let me change it up. But I do think it's worth our time to take a broader look at this. And speaking of a broader look, I've had some comments made to me that, well, this just really affects the township, so what are you concerned about, of course, is that I represent the city. So I do represent the city. I represent what I believe is still the largest municipality in the county and probably one of the largest tax base. And I take the broad view that anything that has the potential certainly to affect my constituents. We border town of Westford, town of Apple River, town of Lincoln. That certainly has potential to affect people come in. So let's get that out of the way and kind of maybe address that concern that's presented to me. The big concern in multinational companies that financially back people what places like Polk County would come in. They want to come in somewhere that has little regulation, that is going to be easy for them to come in and maybe have a lot of leeway, potentially, to do some of the things they want. And I view our responsibility in protecting the public health, and specifically this committee's responsibility in protecting public health. I would like to see some more teeth incorporated into the proposed ordinance that would provide for that, as well as financially. This is something that, in my opinion, has the potential to become very expensive. Outside experts, engineers, if somebody makes a complaint, that would fall on the county to conduct investigation, environmental studies, litigation. Maybe somebody is going to sue the county because I got to live next to this piece, no ordinance to protect me or my family from any potential health risk or inconvenience. I have a motion today that I'm ready to talk about to make a recommendation to the Environmental Services Committee. Like I said, I know everybody has cases to take on this, but these companies, they don't like regulation, and they want to come someplace that doesn't have regulation, but they also are in plenty of places where they're used to having paper things. If they want to be here, then they can put the bill instead of taxpayers putting the bill for everything that we need from them. And I think that there's several different avenues that can protect us financially in that manner. They're going to have to live, that they have to set up a medical, they have to supply performance bonds, and perhaps some other things. Now, these are things, certainly I'm no attorney and I'm a legal expert on any of this, but I'm mentioning things that in my work with municipalities over the years I've seen as being done commonplace, very, very commonly incorporated into ordinances and agreements. I don't know if there's anything that would prohibit counties from doing the same thing that's commonly being done all over the state. So that is kind of my 2 cents here on this. And like I said, I have a motion prepared certainly for discussion to move forward.
I would like to ask we don't have any action on the agenda. We certainly have discussion because we have total update, but I think the further anything we would have to have an action item on the agenda. And when you a little bit about, our ordinances are in place right now, like I did. But October is the deadline for.
Right. I would leave whether or not they could take action in this meeting, defer that to Joe.
So I don't know hopefully what the motion is.
In order to try to open regulation, what that motion is that in some way relate the update. I don't really know how a motion that would potentially take action would necessarily give the public notice that there might be action. Saying that there's an update to be presented to the board is different than saying there's a resolution that we get to the board or something like that. So it depends on what the motion is.
I'm happy to run the motion by you. I certainly don't want us to do anything that we're not supposed to do. We're not taking any action during the meeting. Okay, sorry about that. Thank you for bringing that up. I don't want us to do anything that we're not supposed to be doing. The motion that I have here is merely a recommendation. It's not a resolution. It's not where we are taking any action as a committee. It's a motion that makes a recommendation to the Environmental Services Committee, and I can read that. That would be helpful.
I think the recommendation from what it's based on possibility on the county board. We would ask that I'd be glad to have all the information we can get on our agenda at the next meeting and have a discussion and action.
I think it's, to understand your questions and knowing the timing of the Environmental Services Committee, which has been working on this CUP, and that was the board direction was to have a CUP prepared to take that approach. I would suggest you make, as a committee, one of the recommendations you want them to consider in their meeting. I think it's tomorrow, right? Tomorrow morning. So if you have recommendations, I don't think that's taking action if they just hear what is it we believe in, and they could say, yeah, let's put that in front of the Environmental Services Committee.
And for what it's worth, all of those meetings, trainings that I've had over the years, making a recommendation on an item that are already on the agenda. So it's not on the agenda. It is on the agenda. And to just make a recommendation on an item. I'm happy to, certainly not.
Ultimately, again, I think that depending on, it sounds like you're saying that you ultimately have a proposed recommendation that you want to make to the committee tomorrow for them to take action tomorrow on something that they potentially have on there. So I think that should be fine under the open meetings regulations.
Okay. I guess when we're ready, I can make that motion. Whatever. Okay. So my proposed motion would be to recommend to the Environmental Services Committee to revise the proposed. My recommendation would be that we recommend to the Environmental Services Committee to consider revising the proposed CAFO ordinance to reflect that the developer pay all costs associated with the permitting process of the county, such as, for an example, testing groundwater, surface air quality pathogens, insect vapors, and any other outside consulting services that the county board or the Environmental Service Committee would deem appropriate, such as engineering and legal, and that they would pay those costs by providing one of the following: a performance bond, meaning Polk County, proof of sufficient insurance, or an escrow account in the county's name. I know it's a long motion.
Can we get a copy of that? And secondly, this is not an ordinance, right? This is recommendation. Well, yeah, but I mean, it's a I think we're talking about a CUP, you know. So it's
Yeah, CUP, yeah.
So maybe if you could send that to all of us, and then we can get the right wording in there for you.
Sure. I have it on my
You
phone.
might be able to address.
Chairman Bonifaz, may I take and just provide some clarity on this? The Environmental Services Committee did go down the avenue of looking to see if a performance bond or a surety bond was legal. We did have Ms. Malone and that, they can do a legal review on that, and it came back as a I don't have the exact in front of me that he cited on why it's not legal to do a performance bond. But at their last meeting, if we go down, hold on a second. So this here is section 10.65. Basically, there's criteria that apply to here. So when we look at application and the issue looking at the so all these criteria you can assign conditions on. They can require the applicant to provide more information on as part of the application. This is where we have to be, that's why it's not okay. And when it's not otherwise, that's for any okay. This is something that if we're talking about these 1 through 5, and 5 is just kind of a catch-all. This is information that the committee can request from the applicant or the CUP person to provide groundwater conditions, air quality testing, and that's kind of like a base process that if we're going to have a complaint from what we had when we started, and to help the health department we do have
submarine.
Thank you.
So we can put right down the very end of the page. Okay, sorry. Okay, right here. Here's information on here's the data information in addition to the information required for addition the following information that's sort of that list 1 through 5, and like I said, 5 is kind of a catch-all. So we didn't talk about performance bond at the meeting level, but 14 is not 8. So that's kind of how we're trying to get that across for the county. So, yeah, great.
I see, this appears to me, unless I'm maybe reading it wrong or interpreting it incorrectly, this is through the permitting process. What about after the permit is issued and the complaints start to roll in? What happens then when the county incurs expenses to investigate complaints?
Yeah.
It's part of our statutory requirements to investigate those complaints over the cost. I don't know if we could single out a case in another if there's other human health hazards that we don't charge out for our services. So as far as the human health hazard goes, that's the responsibility of the health department already. Can we do some investigation on that issue? Regarding human health hazard or DNR or regarding if after complaints would be filed and investigation of complaints, if there is a chargeback of expense associated with that. I see all the time, frankly, where they're in various development agreements and conditional use permits.
I've commonly seen where the onus is on them to pay for it. You know, I don't know if all the agreements I've seen over the years are all illegal. I certainly probably wouldn't think so because it's quite common. But you know, I don't know. I'm not an attorney, but I think it's something you know, maybe we should take a broader look at. I may be mistaken, and it may turn out differently, but in the research I've done, these are things that you know, are fairly common.
Sonia, we don't have anything about skateboards or any of this on our agenda. And I would certainly want to see Cran take that to the environmental committee tomorrow. But as far as our agenda board, I want to see this on the agenda next month and have actual possible action. So there would be more security if we have like a unanimous or everything that comes from the county board is brought to us with a recommendation. So if we have it on the agenda and then the committee has a recommendation, we have a motion second as a recommendation. I'm sure that's the proper way to do it. I think we have to end the discussion without the items in on the agenda. Just a point of order here. I agree with what Brandon said. I totally agree with what he said. Thank you. I think one of the things that kind of happened is that you do have an item on here about table discussion, and I think it would be appropriate if anything, we don't have to pass a resolution, we don't have to vote on anything, but I think there could be a consensus from this committee in stating that that environmental committee meets tomorrow, that this discussion came up, this is what was discussed, and there could be a possible informational resolution or more information coming to them once we move into our July meeting. And I think they could take that into consideration. So it would be legally appropriate, I would say to the committee, we could take a consensus of this committee that recommendation be passed on to your environmental committee. Just as a consensus.
Just as a little background on that, I met and went and presented to environmental services on May 13th. And in that meeting, I talked about all different stakeholders. I mean, I kind of went into the weeds on this ordinance and the permit. And stakeholders management and my perspective of the incentive and second party housing that they have approved the licensing inspections, et cetera, et cetera. And John Bond, and in that meeting, he talked about a timeline, and we were trying to figure out the media, whatever we keep on the date. We didn't want to go on, we don't want to help me with this example. Talk about it today, and then have staff to do something in advance tomorrow morning. We actually said we can come back to environmental services on the 23rd or something. I guess. So what that means is we actually need time to discuss it. We want to have kind of goal, or I mean, a everything communication issue, and maybe brand cheap enough, and then put a resolution on for the next time. So I had a resolution originally drafted, and then I learned that I had a curve of our procedure, so I don't have the procedure timing of the resolution, so then I dropped that, but maybe we can do it now and do the resolution.
Yes. Just for the process, for the timeline, tomorrow on the environmental services agenda are two topics related to cases. One is to continue the work with the conditional use permit, the framework and conditions, and two is to formalize the capable report. That's really complete. Back to the CUP or the conditional use permit, we have made some minor changes subsequent to our last meeting, which is maybe every other meeting. But I mean, so there is some subtle changes. For example, the air quality testing are some things that staff is bringing forward to the ESG in their consideration. Any products from this meeting, like Supervisor Atkinson suggestions, Supervisor Morrison's suggestions, or changes I will bring to them tomorrow.
Correct, right through that process.
I will say at the last ESG committee, they made a lot of progress with the commission. They did a lot of compromise, input, a lot of contingencies working together. So there is some movement there. If you would have any recommendations, you would have to come today. There's the possibility that the U.S. committee could move on and further the conditional use to the county board as early as the next July regular meeting. I'm just sharing that with you for some context or process timeline. Because what I heard is three things. This committee is recommending that the DNR representative talk about their permitting requirements. Because again, like Jason suggested, there's a whole other body here that requires permits for large-scale agricultural facilities. So there's that there. This is our floor in the county to provide some restrictions. And that's wonderful. So there's one thing that I could bring to the community tomorrow. The next is, boyfriend, if you wanted to just compile that recommendation, particularly for city bond, or you have a back to either Jason and I.
I'd be happy, I can forward it to somebody to print out, or we can ask them and look at it quickly, it's okay with me.
It's not just a fan. I want to hear your comments. I also want to get the legal thing, because I think you mentioned, and we don't have a aggressive chair, and so being respectful to your presentation.
There was one other recommendation, and forgive me if I'm wrong, but we'd like to see some type of cost analysis, staff time, in order to work with involvement and compliance. We would like to restore complaints.
I guess I was going to say that the development of this proposal, like a permit, for something, I want to build 25,000 of a month. Any fair other cost, all the questions, air, groundwater, surface water, what that means. So, not necessarily later as a catch-up, that can be, you never cost, analyze it, so you know what it is. That's saying up front, before the permit is issued. We get all those answers, some questions.
Will you finish your presentation and then do that?
Well, as Jason pointed out, those recommendations are already in there. So when the developer would come and apply for a permit, the committee could apply any of those conditions. One of the duties of the case report is quite large, but it does identify those four topic areas: impact on groundwater, surface water, air quality, and on humans, as opposed to quality of life. So there is some valuable information in it. For example, in Act 20, those areas that are efficient for that type of land use. We do have groundwater maps, we have soil maps, so for developers, they can look at areas where there's like soil, so we can protect groundwater. So there's some information there that can be valuable for developers.
I guess one thing I struggle with is when I read the Eureka series, and I know I'm concerned about that. I'm not really sure, but I think if some of those, maybe we're really cool, and maybe we add some of the Eureka language in there, and I don't know exactly, but I love their language. I mean, it's a brilliant list of conditional uses and all the things that they will consider. That's why it's really well spelled out, super robust and inclusive, or, you know, things come to a lot of issues. That when I look at this, I don't think that seems as a long-winded effectiveness, but I do like these data. So, if you can take all those things, you can dump it in here, and we'll go.
Yes, you had another comment.
I was just going to go back to the proposal, because reiterating what Barbara said, I think much of that is in there. Now the bonding, I think the issue came back and said it's not legal to require that in this instance. But also, I was looking over at Jared, you had some sense for legality of some things that we were asking for.
So really, what I was going to say is I can absolutely bring that up with Ms. Malone. She has been the person in our office who's been researching these things and at the forefront. I wish that I knew off the top of my head the answers to all these questions, but I can bring it up with Ms. Malone and have her look into whether or not you can have the department, if they're investigating something, have the people that they're investigating pay for something. I think it's unlikely that you'd be able to do that. Oftentimes fines or something like that is how those types of costs are recovered. But like I said, our office would be more than happy to look into that.
Well, that's,
One thing that I wanted to say too is I don't want this to hit on these traditional stuff on the current papers, and as far as air quality, we're going to hit every single farm that there is, because in the spring air quality is not good. And it's all over. We got farmers. That's what we do. And so the air quality, when they're harming the air in the spring and the fall, it's not good. It's part of life. So that's all I have.
we're kind of on our July agenda, we would have on there, discussion and possible action. So we go on all this. And, Brad, you have to environmental tomorrow. Because I'm sure they have paid, and this is kind of last night. And as far as I can see, on the agenda. And then we need to take action tomorrow, and I wrote an agenda for our, board meeting next Tuesday. There could still be an amended agenda. We could do that if, environmental information come up or something.
I think as far as the approval of the CAPER report, yes, but there has to be a public hearing before the board for the conditional use permit. So there's time to change this going forward. But what I might suggest is, Fran read this, is there a consensus in this room as to what Bob can take to the committee tomorrow, or if Fran or anyone come to the meeting tomorrow, are you going to represent the committee, or are you just coming as a supervisor making your recommendation? So that's where I might suggest you get a consensus to say the board met, we decided this, and this. We'd like this integrated into your plan for your CP or.
I will take you and go to the board and take it. This is your presentation. I can't remember what I said.
I just have kind of a final comment. I'm not interested, just in case, there's any doubt. I'm not interested really in one guy's marijuana on this entire thing. And I'm not interested in duplicating, regulation that's already being required, by the DNR. I can tell you the citation processes on that. In case there were any violations or not violations, those companies would happily pay that limited money every single day to violate our things because it's so low that money, that's nothing now. If they're going to find on a daily basis, I think they would probably hear that. And certainly my intent here is to protect both the financial and the health, issues of our citizens.
Well, I think Amy and Fran came up with some new guidance and points here. I hope we can get this finalized for our trial. Tanya, do you have anything else to add for our July agenda?
I guess I would like to note the if you guys have any comments on what will be recommended tonight to the U.S. committee.
And we'll probably even have a good report from our environmental committee that helps.
I think the plan is going to go and read hers.
Is everybody okay with that?
Mr. Chair, one of the things that I think, as a committee member, I would certainly be in favor of having Fran go and read that. I also agree with it. I don't know what Rika has to say. I've just read parts and pieces of that, but I think that should also be brought to that committee. So if they do add language to what they already have, that both of those points are made for that environment.
I think everything will strengthen what our final outcome is, and that's certainly our goal to make it as strong and unique to our colleagues. But we're the ones that are representing our constituents. That's our responsibility. We just done it right.
I think, Mr. Chairman, the question comes down to, does this committee give them the green light, give Fran the green light, call as a committee for her to make a presentation to the environmental committee? I don't know that's moving that way. Or does she go as a supervisor from her constituency and make that? It would be my recommendation that she go as a representative of the Health and Human Services Committee, since she is a member, and if we're in agreement from what both of the ladies said, that both of those points be brought forward. That's my opinion. Okay, you can vote on it, that's okay.
I don't know I think you should go tomorrow with that recommendation that was brought in.
I think as long as that's working, yeah, that's our legal term going on, it's a work. Yeah.
There's a motion with asking for specific terms of what is going to get recommended to the committee were made, and were seconded. A vote for that recommendation, since it isn't any kind of enforceable action, can be made and seconded and voted on today if the committee wants to, but how the committee wants to move forward is up to the committee.
I would just like to see the language brought up in discussion, I think that you could represent our committee.
So does that go?
So then my understanding then is the motion is that some language for what recommendations can get put forward will be brought to this committee and then discussed at a later committee meeting, and then that recommendation will be addressed.
Correct.
Yeah, that should be fine. A vote will need to happen. It was moved and seconded. So we need a vote.
Is there any more discussion on that?
So, are you, I'm putting that motion, you're presenting the motion, and I believe you're the seconder? Motion made and seconded that we give Rand the blessing to, present the, presentation tomorrow at the environmental assessment. All in favor, say aye. Aye. Tanya, we discussed on our July meeting and so far, and anybody is welcome to bring any additions between now and the next publication.
So for clarification on the next agenda, you are requesting the DNR be present to talk about their permitting requirements? Yes. Any other topics that you would like to add? So you had mentioned discussion and possible action on a resolution,
or maybe next meeting we'll have some other updates from the environmental committee that we want.
So an outcome of tomorrow's meeting, probably? So an update? Yep.
I guess I want a placeholder in case you want to have anything. And
I did possible action.
running the summer.
That's the hard part. You might want to further something that, based on our new information, I'm trying to get somebody from the DNR from all of them up here. But they have a big station there, and they're actually the ones that are doing the building and permits and all that. And so we want to be in coordinates with everything that's in place right now.
Jason and I can coordinate that. Jason and I will coordinate that. But you know.
Yeah, I'll be in touch with you. What's your bird? Second? Favorite guy? Insurance all over the book.
I got to take that short.